Afternoon teacher, my name is Leila Maya. My topic is birth outcome from pregnant women with HIV using tenofovir and tricyclic. Definition: HIV, the virus that causes, can be transmitted from an infected mother to her newborn according to the World Health Organization. Without antibacterial treatment of the 30% of babies of HIV infected mother.
Antiretroviral medications are used to prevent the perinatal transmission of HIV from an infected mother to her baby, but this benefit needs to be weighed against the potential toxicity and adverse pregnancy outcomes associated with combination antiretroviral therapy. The PROMISE trial enrolled 3,529 women in the second trimester of pregnancy who had asymptomatic HIV infection with a CD4 count of 350 or more and randomized them to one of three groups. The zidovudine alone group received zidovudine during pregnancy, a single
Application in nursing. Strengthen prevent strategies for HIV transmission and syphilis during pregnancy.
To get data, efficacy and safety data in pregnant women, and to have it in a timely manner. And this has been a long-standing problem that
1. Serve to reduce the risk of mother-to-children transmission of HIV. 2. It serves to protect the mother out help.
If you have HIV/AIDS and find out you are pregnant or think you may be pregnant, you should let your healthcare provider know as soon as possible.
Some HIV/AIDS medicines may harm your baby. Your healthcare provider may want you to take different medicines or change the doses. It is also possible to give HIV to your baby. This is most likely to happen around.
Cons. 1. Medication can alter the baby's life. 2. They may be allergic to some pregnant women.
As prescribed, will greatly lower the chance of HIV being passed to the baby.
Will my pregnancy make my HIV worse?
No, pregnancy does not make HIV progress faster or get worse. However, to avoid transmitting the virus to the baby, it is important for a pregnant woman living with HIV to seek prenatal care and begin antiretroviral therapy to avoid transmitting the virus to the baby.
Does the HIV medicine, ART, hurt my baby?
It is important to see a doctor who is knowledgeable about HIV treatment during pregnancy. An informed doctor will know the medicines that are safely prescribed for pregnant women living with HIV. This will ensure that the pregnant woman and her baby get the best care possible. There is some evidence that the use of ART can increase the chance of preterm birth. It is important for the healthcare provider to be aware of this potential complication in order to monitor a woman's pregnancy.
Will my baby get HIV?
HIV can be passed from a mother to her baby during pregnancy as well as during and after delivery. However, there are things that can be done to prevent the baby from being infected. Your baby has the best chance of being born uninfected if you take HIV medicine as prescribed throughout your pregnancy. To stay healthy and to have a healthy pregnancy.
Issued application in Ecuador. Among the problems that apply in Ecuador is the poor administration of medication.
Back in 2002, Casilda Masango found out she was HIV positive. Death and helplessness were the first thoughts that ran through her mind, but thanks to a campaign launched by a Catholic institution, things started changing.
Back then, everyone said that if you had HIV, there was nothing that could be done. But thanks to the DREAM project, I've learned that there's treatment and there's hope.
The community
Conclusion. This medication serves to prevent the spread of mother and child and aids to maintain the mother's own health.